All right, everybody, welcome back to the Gyno Gurus. So today we're going to have a fun episode. So if you've watched our previous episodes, we've mainly been doing them over just certain topics and just kind of talking about that topic. But today we're actually going to do something fun. We're going to do a fact or fiction episode and just kind of discuss some myths or topics that are maybe a little misunderstood or controversial, and then not that controversial, but and to kind of talk about that and then go from there. So I think that today we're probably going to stick to 3 topics, and those topics are: you can't get pregnant when you're on your period, natural family planning is only for women who have regular cycles, and then birth control makes you infertile. So we're going to get started with our first topic of you cannot get pregnant if you have sex on your period. So Dr. Mandel, is this true or false?
Well, it's false because, well, truly, if it's a real period, that is probably true. But you can have bleeding that's not a period, and that's where the problem comes in.
Yeah. I think something also, too, because we know, technically, like, sperm can live in the reproductive tract for up to 5 days. So yes. Theoretically speaking, even if you do have a normal period, would you say that if you are spotting on day 7, you have intercourse and you happen to ovulate on day 11, which can happen,
yes,
then that also can result in pregnancy as well. But it's very interesting that sperm can live in the GU tract for 5 whole days. That's a long time.
Oh, yes.
It's a very long time. Yeah. But yeah, so all that to say, that is a myth that a lot of people don't know about.
Yes, you definitely don't want to rely on that because anybody in women's health has had experiences where patients come in pregnant who had their period. So
so that first one is false.
Yes. Okay, so and let's take a moment just to explain what a period really is. Yeah. So you have bleeding and you have a period. So a period is really based on that you ovulated probably at least, say, 12 days beforehand, you didn't get pregnant, and your body is sloughing the uterine lining off. Usually it's 14 days. You could have a short luteal phase. It could be maybe even 10 days prior, but roughly on average, say, 14 days. So that's what really a period is. It's that you didn't get pregnant. But if you have very irregular periods or you have irregular bleeding, meaning you may bleed for reasons not related to that hormonal event, that can set you up for getting pregnant when you had intercourse on your period.
Mm-hmm. Are you mainly talking about like spotting or like anovulatory bleeds?
Well, it can be either one.
Yeah.
Because sometimes it's hard to really to sort that out, and spotting.
And also, really you can have spotting during ovulation too.
Right, I was just going to say that too. Some women spot when they ovulate.
Yeah. So it's like period or ovulation. Which one is it? Because one of them is really in the danger zone there. So
exactly. That's and but most women who spot when they ovulate, they probably have had that before.
Mm-hmm. That's true. So if you're aware of your body and like in tune with it,
right, you may know that you get spotting when you ovulate.
Sure. Yeah. But yeah, very good. Anything else to add to our first fact or fiction topic?
No.
Okay, very good. So the next one is I'm excited about. So the next one is natural family planning is only for women who have regular cycles. So let's break it down first and just kind of talk about what natural family planning is, also known as NFP. So basically, natural family planning is when you are either trying to avoid pregnancy or become pregnant, and that is by tracking your cervical mucus, relying on LH strips, and then temperature tracking typically. There's other devices out there like Mira and Anita, which I've mentioned at least in one of our previous episodes that some people will like to track their cycles on. But really, if I have a patient who's going to be using an FP for either trying to avoid or trying to conceive, I'll recommend at least 3 methods of tracking, which in that case would be LH strip, cervical mucus, and then temperature. So basically, the myth is that if you have irregular cycles, that this is not a method for you. And a lot of people out there, including maybe Dr. Mandel, I don't know, we will see, will say that that is false. Now, I am going to be the devil's advocate and say that it is true. I do believe that natural family planning is for people who also have irregular cycles. So what I'm going to start with is I want Dr. Mandel to kind of walk through his rationale of like why it might not be a reliable option, and then I'll kind of respond with my thoughts about it and how it can be helpful, and then we'll kind of go from there. So take it away.
Okay. So first, natural family planning is much more challenging for a patient who has irregular periods. If your cycles are regular, then things like monitoring your cervical mucus becomes much easier. Monitoring, you can do temperature too. And to explain that temperature rises after ovulation. And if you use a very accurate thermometer, you can see the small changes in temperature. Now, we say basal body temperature, which means that you take your temperature before you get out of bed. Even a little bit of activity raises your the thermogenic stuff in your body, which raises your temperature, and that could be enough to make your temperature monitoring inaccurate. So you have to do it right.
Well, which a lot of people will use like wearables, like a temp drop or an Aura ring or something like that.
Nowadays you have much more modern things.
Yes.
I remember when I started out, you had these mercury thermometers, and they would be a normal mercury thermometer. I don't know if nobody uses them anymore.
I've seen one in pictures.
Yeah, in the Smithsonian. But they are marked in, I think, 0.2 of each line is 0.2 of a degree. And these were, I think they had them down to like a 0.5 degree or 1 degree. So, or rather 1/10 of a degree or 0.05, And so you can monitor that change. But if you do 0.2 of a degree, you could miss it. So a regular mercury thermometer wouldn't work. But now, thermometers are different.
Right.
So, but anyway, so monitoring requires, if you go by temperature, is basal body, which means you haven't moved, basically. You have your thermometer by your bedside, or if you have a wearable, then you could see that. Cervical mucus, you can monitor cervical mucus. Now, when we say, let's explain the physiology of cervical mucus. So after your period, in your cycle, so you can start monitoring your mucus, and you can see mucus gets stretchier as the cycle progresses.
It looks like an egg white whenever you're around ovulation.
Egg white.
Yes.
And you can actually use it. Years ago, we used to do this clinically. We used to do something called a spin Barkite test, which we would have a patient come in when we thought she was getting close to ovulation, and you take a specimen of cervical mucus and you put it between two glass slides, and you could actually stretch it. And when it hits about 10 centimeters, that would be what we would call pre-ovulatory mucus. And then after ovulation, due to progesterone rising, and it happens very rapidly after ovulation, the mucus becomes very thick and tenacious. And if you just think about the physiology of this, that thick, stretchy mucus is very hospitable to sperm. So if there's sperm around, it lets them in. That thick, tenacious mucus, blocks the sperm from penetrating. So that once a patient's or a person is pregnant, that they're not receptive to more sperm. That probably be a bad idea, or even other, bacteria and stuff that potentially could get into the uterine cavity. So when you monitor mucus, that's what you're looking at, is that stretchiness of that mucus, that egg white kind of consistency. So then monitoring for an LH surge. So LH is called luteinizing hormone. So mid-cycle, just prior to ovulation, like 24, 36 hours prior to ovulation, the pituitary gland releases luteinizing hormone, which is the signal to your ovary to release an egg. And that lutein, when that egg is released, which is 24 to 36 hours after your LH surge, progesterone is starting to be produced and the cervical mucus thickens up. Mm-hmm. And the relevance for knowing that 24 to 36 hours is if you're doing ovulation test kits, when you get your LH surge, it's not the moment of ovulation. It's going to be.
It's impending.
Yes, impending. Good. That's a good way to put it. Impending ovulation.
Yeah.
So
very good.
Yeah.
So basically kind of going back to like the cervical mucus. So before we had started the episode today, we were kind of talking about just like, who would not be able to use this and why. And I think one of the things that I like about natural family planning specifically is even if you are using it, try to get pregnant, try not to get pregnant, but it can also give you really good clues about your hormones and just like what your cycle is doing in general. So in a healthy cycle, kind of like he was saying, as you approach ovulation, you're going to kind of start to notice a wetness at the vulva. It'll peak around the time of ovulation, the really stretchy mucus, and then it should thicken up and you should feel pretty much dry the rest of your cycle essentially. Now, in people who have anovulatory cycles, which means that you're not having ovulation occur, you can be having this mucus basically all throughout the month because you'll kind of have these surges of estrogen, like where your body is kind of trying to ovulate, which is also very common in women who have PCOS. They'll even have multiple LH surges throughout the month and not ovulate.
But not enough to trigger ovulation.
But not enough to trigger ovulation, yeah. So basically, with that being said, people who have PCOS, you theoretically can still use natural family planning if you are abstaining every single time that you have cervical mucus that's an egg white consistency and every single time that you have a positive LH surge. So really what I would tell patients who are using this method, if you have a healthy ovulatory cycle, is the minute you recognize the wetness to start abstaining or using a condom or backup method, and then 3 days after you notice the mucus is gone. So that is pretty much covering your entire fertile window. But kind of going back to what you were saying, well, it might not be, a right patient for it if they have cervical mucus throughout the month. To me, that's a big indicator that something isn't right, which that way we could look into it. And then the goal is with natural family planning at the end of the day is to correct the hormonal imbalances so you are ovulating regularly. And then again, even with that, it takes time, it takes practice. It's not for everyone. But there are patients out there for either religious reasons or personal preference who do not want to use birth control. So this is an option. So I think that's just something that we miss sometimes in like the traditional gynecology world.
I agree with you. I think that in medicine that we're very we're biased, that we want to treat people and not have like a failure. So we don't even really mention the natural family planning maybe as much as we should, because it's harder for a patient to interpret.
Yeah.
And it's now, I have patients who use natural planning, family planning, for many years and never had an unwanted pregnancy. Mm-hmm. So somebody who's attuned to it can be very successful at it. But you have to really be attuned.
To really, really practice. And I was telling Dr. Mandel before we started today, like I went to school for this and I have, had training and education and experience. And whenever I started that journey for myself, it took me about really 7 to 8 months to really learn my cycle. And I really think that whenever talking about this type of stuff, using, tools like Mira or Anito, I call them training wheels because, for a patient, obviously it's expensive, but it's a nice way to kind of get yourself started, because then you know exactly what's going on and you can kind of correlate it to the symptoms that you're having and your temperature change and all of that stuff. But at the end of the day, all that to say, it is not super easy for everybody, but it is very rewarding once you master it. I will say that.
Yes. And one of the other things we were talking about, if your periods are regular, it's a lot easier to master because it's a repetition every month. Mm-hmm. When your periods are irregular, maybe you go 3 months till you ovulate. Mm-hmm. So you're not really, you may only say ovulation once or twice in, say, a 6-month window. So you're not really.
But that's when you use it almost for
okay,
something's up.
Yeah.
Let's bring it to your provider and let's fix it. And so then, so I think in that way it can be a really great tool. But you're right. I mean, for somebody like that, if you're really just like trying to get pregnant or to avoid getting pregnant, it's like not a good option, but it is a good tool to like be like, hey, like something's going up and we need to address it, and then restore ovulation and then be able to learn your cycle and track effectively.
Absolutely.
So all that to say, I'm gonna still stick with that it's false because if I had a false sign, I would still say that. But yeah, again, clinicians will differ in opinion, and I knew that we kind of had separate views on it. But I thought it'd be interesting to talk about.
I don't think it's false, but I don't think it's applicable to everybody.
Sure.
I think you really, if getting pregnant is not a problem for you and you're using it for a contraception, then, and you say, okay, well, if it doesn't work, then it doesn't, it's not critical. But if getting pregnant would be really difficult for you to have, then if your cycles are irregular, it's...
Yeah, of course. It's what's, good for the patient. But I think just recognizing there is a population of patients out there who would benefit from it is a good thing. So for sure. Okay, so do we have anything to add on this topic?
No, I think that covers it.
Okay, that was good. And then, so we'll finish up today with the last one. So birth control makes you infertile. That is very, very, very false. I have a lot of patients come in who are around my age who are very worried. Again, he's a very popular man. At least 2 phone calls for podcast episode. Oh,
sorry.
All right, guys, we are back. As mentioned, Dr. Mandel is a busy man on call, having to take his phone calls. So, so jumping right back into kind of what we were talking about, basically to kind of recap, birth control does not make you infertile. Like I was saying before, I have lots of patients, I feel like, who are my age who come to me who are very, very worried about that whenever they've been on the pill for a long time or had an IUD for a long time. And so, this is a blazing false. It does not make you infertile. I think that something to note is while birth control does not make you infertile, it's important to note the reason why you got on birth control in the first place, like pre-existing conditions like PCOS, or if you had really, really painful periods, like having endometriosis potentially. Those things are things that could potentially cause infertility down the line, but the birth control itself does not cause infertility.
Oh, that's absolutely true. And other underlying causes besides even PCOS is, potentially somebody could have maybe an undiagnosed thyroid issue, and they were having irregular periods because of that. Because not everybody, who shows up to their doctor's office who has irregular periods really gets evaluated.
Yeah.
Sometimes they just say, well, here's a birth control pill. You're young. You're fine. Here's birth control pills.
Which makes me so sad. Everyone who gets put on birth control for a reason like dysmenorrhea, which is painful periods, or irregular periods, at least in my practice, gets a full set of labs. And at least we know why you're having the symptoms that you're having before putting you on the birth control pill.
I agree. I think using covering something up is... it's okay to treat something symptomatically once you know what you're treating.
Exactly. Because then once you get off of it, and that's why I tell people, like, whenever I have girls who come in who are, 16, 17, it's like they really just, want to be on it for regular cycles or like that plus contraception. It's like, I care about you now, but I also care about where you're going to be, in 13 years, potentially, whenever you're thinking about fertility. And it's like, so let's look into those things, like try to map out potential problems. And then, of course, we'll treat symptoms and for contraception, of course. But so.
Yeah. And also, sometimes we'll see patients who they get put on birth control pills maybe when they're a teenager for maybe they're sexually active at a young age. They get put on it, and then they're not looking to get pregnant, and then 15 years later they're 30, in their early 30s, maybe even more than 15 years, they get off the pill and they're having trouble getting pregnant. Well, they never really knew whether they were fertile or not, and even if they were fertile back when they were 15 and put on the pill, when you get into your 30s already, there are other issues that could come up that can cause fertility issues.
Right.
So pills don't cause infertility.
Right, yeah. And that can seem really scary because there are some people out there who will say that it can, and that definitely frightens some people. And there's nothing out there, to my knowledge, that's ever shown any evidence of that. So I think that's important to note.
I would agree, and I would add that if anything, the pill has the potential to protect fertility. I know Alex doesn't necessarily agree with this, but somebody with endometriosis, and the way we definitively diagnose endometriosis, you have to have like a laparoscopy and look inside, and you should really get a biopsy specimen to show it's really endometriosis. But a lot of young women are put on birth control pills because they have bad cramps, and some of them don't have endometriosis. Not to say everybody with cramps has endometriosis, but some of them, no doubt, do have endometriosis, and it's thought that by at least some people, and there's some, I'll say, physiologic reasons to suspect that this is true, although I will readily admit I'm not aware of any study that's actually demonstrated this, that birth control pills may slow the progression of endometriosis down.
Yeah.
So that, I think, is an honest assessment.
Yeah. No, I think that's fair. I, like you said, we've talked about this before. There's really no way to actually know, because we don't have a study. It's like you're going to have people who have very painful periods and confirmed endometriosis, and you're going to put one group on the pill, one group not on the pill, and then see who, progresses 10 years later, who does what.
And you'd have to do follow-up laparoscopy.
Follow-up laparoscopy, that would be a mess. But yeah, definitely, I just have a little, a little different opinion. I think just from, the world of the NAPRO fertility and all that stuff, it's a lot of the endometriosis excision specialist surgeons will argue that it doesn't prevent the spread of it, but could maybe prevent size growth. I don't know. Of course, I'm not a surgeon, so I can't speak to those things. That's just what I hear. So
well, it is interesting that if you look at we'll go on a little bit of a rabbit hole here, but if you look at the medicines that are really used to prevent or to treat endometriosis, I should say, they really tamp down the hormones and
they put you in menopause, essentially. Yeah.
Those are the most effective medicines. Those don't even work all the time.
Right.
And matter of fact, I had a patient who was on which one? One of the GnRH antagonists, okay, and she had a endometrioma on her right ovary, which I excised, and then a year later, while she was on the medicine, she was on the GnRH antagonist, and she developed an endometrioma on her left ovary while on medication. So even the medications that have been shown to slow the progression don't work all the time. It's a very complicated
it is. I mean, it metastasizes like a cancer, quite literally. It's a systemic disease. Yeah, it's not even just gynecological. It's So basically all that to say, kind of pulling it back into, does birth control make you infertile? My final answer on that's false. So it's Dr. Mandel. So do you have anything to add to that topic at all, or?
No, I think that's pretty much it. Birth control pills mask symptoms, so you just have to keep that in mind. It could somebody with PCOS, it could regulate their period, but doesn't mean that their PCOS is cured. Somebody who has endometriosis and gets bad cramps, their cramps can be cured, but it doesn't mean that endometriosis is cured. So it just kind of masks the symptoms. So
well, very good. I think so. We're going to end with that topic today. We have, I think, 3 or 4 more that we're going to get to in the next episode. But I think that was really fun. I really enjoyed that. So I hope.
And if our audience enjoyed it, please remember to like
and subscribe and share.
Yes.
Yes. All right, guys. Well, thank you so much for tuning in. I hope that you guys enjoyed this episode, and we'll be back next week with the rest of our Fact or Fiction.